Hi, my name is Nayab. I'm a psychological therapist working within the NHS, and I'm also an associate with a private therapy app. I'm trained in a variety of modalities, specifically CBT, EMDR, DBT skills, CBASP, and most recently schema therapy. Having such a skill set enables me to treat a variety of disorders such as OCD, anxiety, generalized anxiety disorder, health anxiety, specific phobia, panic disorder, depression, chronic depression, PTSD, and so on. So when a client comes to see me, what generally tends to happen is I will do an assessment on their needs. I will assess their symptoms, how it's affecting their day-to-day functioning, how their symptoms affect their mood. I will look at their history of when it first started, and I will do some questionnaires on their clinical presentation. Depending on what their clinical presentation is, the questionnaires may vary, and that will give me a more understanding of the severity of their symptoms and the complexity. The general assessment then tends to lead towards any questions that the client might have for me, expectations of therapy, what to expect from me, what I will expect from them, and also what are they hoping to achieve in therapy, what's their goal. So there are a number of things that make a good practitioner. I would say for me, what works for me is to be able to listening to the client. It's very important for the client to be heard and not felt judged. So when a client comes into therapy, they are kind of like pouring out their vulnerability to you, and you've got to honour that. You've got to look after that in a best way. And by that, I mean by being non-judgmental, by not discriminating, by not generalising, and because everybody's different. You might have 5 people coming in with depression, but everybody's got their own story. So being able to listen to individuals is really important. I also believe that having the knowledge is really important. So your therapist being knowledgeable and having the skills to help you. I also believe that the therapist must know her or his own limitations. So when you can't treat somebody, or this is not in your area of expertise, then being able to say that to the client rather than wasting your time, their time, and also their money. Providing the client a safe platform, to convey their message, to express what they want to say, for them to tell their story. It's really important that they've got that safe place and they feel safe. I would say that if a client doesn't feel safe with a therapist or doesn't feel connected to the therapist, then rather than stopping therapy altogether, having a discussion with the therapist of what you're finding difficult, so that you can come to some kind of an agreement, a better way of working together. And if that doesn't work, then for the therapist to be able to direct the client to somebody else who might be better equipped to help them. It isn't unusual to experience psychological difficulties. In actual fact, it's very common, and everybody in some stage of their life will experience some psychological difficulties, because life happens, life happens. People, your loved ones pass away. You can lose a job, you fail your exams, you experience bullying, there's low self-esteem issues. You might have a really difficult upbringing. Your emotional needs or your physical needs may not have been met. So there's a lot of factors that can lead to difficulties, and sometimes those difficulties stick with you and it's difficult to move on from them, and that's where therapy helps. I tend to use CBT predominantly for a lot of anxiety and depressive disorders. Where depression is more chronic, I might use CBASP, which is Cognitive Behavioural Analysis of Systems of Psychotherapy. That is more for people who have been depressed for longer than 2 years and that they experience interpersonal difficulties. Speaking of interpersonal difficulties, I can use schemotherapy for such clients. So for example, somebody comes with a borderline personality disorder presentation or have a diagnosis of BPD, or now better known as EUPD, I would probably use chemotherapy to help them. Or if they're more interested in skills-based work, then DBT skills will help them. For trauma work, I may use trauma-focused CBT, but I would also use EMDR depending on how much trauma the client is bringing to the session and how much they want help for. I would use probably single CBT for a single trauma and EMDR for multiple traumas. My expertise lies in, I believe, trauma work. I like working with people who have post-traumatic stress disorder, and I work quite well with both single and multiple traumas. And by trauma, I would say that looks like, I know a lot of people think that it's only war veterans who have PTSD, but that's not true. People can have PTSD symptoms if they've been involved in road traffic accidents, physical, sexual abuse, any distressing incidents which has left them with flashbacks or recurring nightmares. EMDR would be really useful with that. I do have a really good recovery rate when it comes to trauma work, and I treat it with a passion. Lastly, I would say give therapy a chance. It's not easy coming in, asking for help. I appreciate that. And I try my utmost best to make it a comfortable experience as I can for the client. But, come in, have an assessment, or do that 15-minute consultation, querying, whatever it is that you want to query about therapy and your symptoms, and take it from there. Yeah.